I was kind of asked at my first oncology meeting, do you want to freeze your eggs? Because chemotherapy can, obviously affect any fast growing cells. So yeah, when you're entering your 30s, like, okay, mortgage, do I want kids? Do I want to do all that? And this is all
it's a lot of big decisions,
kids,
isn't it?
Yeah. It's like cancer, kids.
Yeah. So, all of a sudden, I've just finished my PhD and here's cancer and kids coming in. So with me in studio is Aoife Canning. Aoife is 30. I hope you don't mind me saying that, Aoife.
Right.
And Aoife has a PhD in immunology. She sat her PhD in March, and Aoife was diagnosed with cancer in May of this year. Aoife is also an excellent piano player, and she has a lot of strings to her bow. So Aoife, maybe you tell us first, how you discovered you had cancer, because obviously you're very young.
Yeah.
And you wouldn't fit into the normal age bracket.
Yeah. So I found it one night, like I would usually be doing the checks and everything, and
you would be doing the checks every night.
Yeah,
right?
yeah.
So were you always very aware, and were you always checking?
Yeah. So when I did my master's in NUI, or University of Galway, it was in breast cancer, and I was about 25 when I finished that. So from 25 onwards, I had a bit more understanding of, what to look out for, how to check and everything like that. So I'd be a little bit more vigilant since then. Like beforehand, I didn't know. You don't really think it's going to happen.
No, it's not something you'd be thinking of when you're in your early 20s.
Yeah, absolutely not. Like it still happens, but
yes. And everyone should be very aware of it, and everyone should be checking. But I suppose it's not just on the radar for when you're that young, generally.
No, when you're that young, you're not really looking out for anything. Like you're going out, you're in college, you're going for pints and everything. It's like the last thing you're going to be thinking is going to happen to you.
Yeah.
But yeah, I just found a lump one night. I honestly thought it was one of those buttons that you see on the mattress. Like I thought I was lying on something weird, and yeah, it was just this tiny lump, and it was quite sore. So I was lucky enough that I got an appointment with my doctor
and because of your knowledge and your masters and all the rest of it, straight away, did you think this might be something sinister?
A little bit, yeah. Like I hadn't heard of it being sore before, and it was movable and it was quite hard. And, I'd heard stories about people with fibroadenomas or cysts or anything. It didn't sound like that. I'm usually very glasses broken on the floor rather than half empty, half full or anything. So I was like, okay, this might be something. But yeah, I went to my doctor like the next day. Luckily, I had an appointment at the University of Galway Student Health Clinic, and she got me referred to the breast check at University of Galway Hospital. And they saw me the next week. So we got like an examination, a biopsy, the ultrasound, the mammogram, everything like that.
Yeah, the triple check.
Yeah.
Triple assessment.
And then the week later, I got a phone call to come in and to bring somebody with me. And yeah.
So was that the first stage where you thought, okay, there's something going on here?
Yeah, like usually because they had said that I would hear about it in 3 weeks or a month or anything. So they were ringing me the week after, and that was, okay, that's not great. And then asking me to bring somebody with me, that was a second not great. And yeah, I went into the clinic.
Was there cancer in your family?
Not really, not breast cancer.
Yeah.
There'd be kind of, like I think my uncle had like brain cancer, and but it wasn't.
Yeah, but
seen
there's
as,
no
like,
breast
genetic
cancer,
or
so it
anything.
wasn't
No.
one of those things.
No.
And who did you bring with you to
My boyfriend.
Your boyfriend,
Yeah.
okay.
So-
And how was the news explained to you, I suppose, and how did you react?
Well, initially, like my surgeon set me down, and we had a nurse. My nurse was there as well, and he just said that they found abnormal cells and that it was a form of breast cancer. But we weren't
what was
sure.
your actual diagnosis?
It was invasive ductal carcinoma, so that's what we knew initially, and then after like the surgery and everything, it was stage 1 triple negative.
Okay.
So yeah, so at that time we didn't know what it was yet because the staining wasn't back. And I just had to get an extra biopsy on my lymph nodes just to make sure it wasn't in them. Like they had, but just to get a few more because, yeah. And yeah, initially I was just chatting to my surgeon about kind of the science of it. Like, was it primary? Was it secondary? Like, had it metastasized or anything like that? And And it was only when they mentioned kind of getting an oncologist and getting chemotherapy that I kind of started realizing that, yeah, this wasn't going to be fun.
Yeah.
Yeah.
Yeah, this is going to be a journey from here.
Yeah, it was just like, okay, I have breast cancer now, so go with that now.
And do you feel that, you know, having done your master's, you know, and having such a huge awareness of, I suppose, all the you know, the intricacies of breast cancer, was that better or worse, or more scary or less scary, you know, having such a wealth of knowledge about breast cancer?
I think initially probably wasn't great because, you know, triple negative is definitely one of the scarier because it's quite aggressive. It grows very quickly.
So you knew when the minute the words were said, you knew exactly what you were looking at.
Yeah. So I guess at that point I was terrified, you know, because like once we found out it was triple negative, it was like, okay, this is gonna, because it's a lot less. You don't usually get immunotherapy like in the earlier stages. It's going to be like surgery, chemotherapy, radiation, and just try and get rid of any cells that are lingering or anything like that.
So was that the treatment plan that was outlined for you at that point?
Yeah. So because it was in an early stage, it was like 1.2 centimeters, I could get a lumpectomy. So 2 weeks after being diagnosed, I had the surgery and it was gone. And then the chemotherapy and radiation were for any little baby triple negative cells that had like clung on or anything. Because, you know, my surgeon was fantastic and we got clean margins. So that meant that the cancer hadn't spread out amongst its little clump. And
so you got the diagnosis in May. So you're now kind of, at this stage, you went to June. You had the surgery in June, did you?
The 15th of May.
15th of May, you had the surgery.
So 2 weeks after.
And you're talking 15th of May as in 3 months ago, 15th of May.
Yeah.
Wow. Okay.
So it's quite a quick
It really is, isn't it? Yeah. Yeah. And you had just, you had sat your PhD Viva only in March.
Yeah.
Okay.
So 2 or 3 weeks after my Viva, I found the lump and yeah.
Okay.
So timing.
So the lumpectomy is on the 15th of May. And then when did you start the chemo?
17th of June.
17th of June.
Yeah.
Okay.
So I started 4 rounds of doxorubicin. So it's kind of nicknamed the Red Devil. It's like bright fluorescent and yeah, it's quite rough. But yeah, I guess there's always such emphasis on, you know, patients to keep like positive mindsets and everything. So, you know, I was kind of saying it to my nurses and my friends and everything that we were just going to call it forbidden slushy so that we had a bit of a control over it. And it's like a little bit nicer of a name than Red Devil. And it's like, oh my God, what am I in for? Like, yeah. So that made it a little bit easier. You just find ways of, just being a little bit more comfortable.
Yeah, ways of looking at it slightly differently that are going to suit you better. And actually, I suppose taking it back a step, when did you tell your family and how did you tell your family and how did they react?
Well, my parents were on holidays, so it adds to the extra Netflix kind of part of it. So I had to ring them and they were coming back in 2 or 3 days. So
this is after diagnosis now, was it?
Yeah. So the day of diagnosis, I rang them. And yeah, I texted my brother as well. And
how were your parents?
Yeah, they were a little bit upset. Yeah. I guess, you know, like the shock. Like everyone reacts very differently. And I think over the next coming days, it started hitting a little bit more. But
how had your boyfriend reacted?
Well, the nurse said he went pale. So I wasn't looking at it, to be honest.
Yeah.
But yeah, like he's very practical and everything. So, no, he was really strong and, you know, kind of comforted me and everything like that. Like he's amazing. But yeah, I think everyone was kind of just a bit shocked because, you know, like 29, you're not really, like it happens, but you don't hear about it as often as people that are a bit older or anything like that.
Yeah. Which I suppose is why it's great to hear about it because it just, you know, the awareness has to be there that it can be any age.
Yeah, literally. It can happen to absolutely anyone. Like you even see it on social media or on TikTok and there's 20 somethings like even in their teens getting breast cancer. So it's definitely a little bit more kind of hard hitting and I guess it can be a little bit more personable when you're hearing about it and like seeing people talk about it rather than reading it because you can get a bit detached and dissociate from it. And it's like, oh, it's a story, it's hypothetical. Whereas, you know, when you're seeing people on social media or on podcasts or anything, it's like, yeah, no, this still happens. It's just not televised as much or it's spoken about as much, you know.
Yeah. And how when you started the chemo, how was your body tolerating the chemo? Or the slushy, as you were calling
The
it?
slushy, forbidden slushy.
Forbidden slushy.
Yeah, it was quite rough. The first week was awful. Like, I didn't get as many side effects as I was expecting, but like the nursing staff, I mean, like they give you antiemetics to stop you getting sick and everything. But I found that it just feels like fatigued, and you're sleeping an awful lot, and you're just absolutely exhausted. Like it kind of feels like you've weights on you and you're trying to walk like underwater. That was the best way I could describe it.
Yeah, that's a great description.
Yeah, it's very strange. Like, you know, you get out of bed and you just feel completely off. Like you know something's wrong and you can't fix it.
And were you kind to yourself?
At the start, I wasn't. Like I was quite. I guess because it was like stage 1, I kind of didn't feel like I could feel this way. Do you know? Because
so you almost felt like you didn't deserve to feel that way. Is that what you're saying?
Well, a little bit. Like as in like I was a bit younger and I was stage 1. And was like, oh well, I can't really complain about this because there's people that have it, you know, further stages or anything like that. But after a while, I just kind of give myself like 1 or 2 days where, this is awful. Like I'm allowed to be angry about this.
Yeah.
And
you're 29 years of age.
Yeah.
Yeah.
It's just like all the plans gone out the window. But yeah, like after a while, I'd spend chemo weeks at home and, you know, that mum and dad kind of pamper me a little bit. And
and you
like,
let them pamper you, I hope, did you?
Little bit, yeah. But have meals made and everything. But yeah, like, I mean, I got a bit more comfortable being, okay, I'm tired, I'm going to go to bed. I don't feel like talking to anyone, so I'm not going to talk to anyone. And then just like if my friends were messaging me or anything, it's like having a bad day, I'll message you tomorrow, do you know? And not ghosting people, but also being like, okay, I need to shut off, like sign out of every social media possible and just completely blank and watch reruns of something.
And how are your friends? I mean, they must have been, you know, flabbergasted, I suppose, for want of a better word.
A little bit, yeah. So I waited until after surgery to let them know because I just wanted it like behind me, that I wanted it out, and I didn't feel comfortable talking about it until I knew that the tumor was out. Like, but no, my friends were fantastic. Like, other than the whole shock factor,
But once that was over, they were
amazing. Yeah, like the only different, they treat me completely the same as before. Like, I guess the only difference now is, how's chemo going? How are you feeling? And then back into regular chat. And, you know, once they kind of knew that I was taking the kind of, let's just take the piss out of this, like let's make a few jokes about it, they were very comfortable, and we all just like,
so you made it easier for everyone really when you kind of take the heat out of it like that, don't you?
A little bit, yeah, because like, you know, you're not going to forget about, like, you still have to go through chemo, and, you know, some people still have to have chemotherapy to reduce it first, so it's going to be in the back of your mind, like you're not going to forget about it, so you may as well make a joke about it and just like, there's obviously going to be terrible days where, you know, you get upset and everything, but
and where are you now in terms of chemo?
So I have 2 more rounds left. Yeah. So I'm hopefully finished September 23rd, and then fingers crossed.
And has it, you know, has the pattern of how you feel after each treatment, has that changed or has that stayed the same? I mean, you know, in terms of, you know, the days after the treatment, after your chemotherapy treatment?
Oh, with the doxy, I would be out for about a week. So you'd be exhausted, and, you know, your appetite would be gone.
Is it every 2 weeks you're having it?
Yeah. So I had 4 rounds of doxy, and it was quite rough. So I'm on paclitaxel at the moment, and it's mostly kind of tiredness and brain fog. Like, there's no nausea, there's no, like, I don't have to take kind of white blood cell injections, because chemo can, you know, cause low blood cell counts. And I was on different kind of injections as well when I was on doxy, and I'm not on them anymore, so it's a little bit easier to handle. So I have 2 more rounds
and then do you have radiation then after that?
So I have 4 weeks of radiation in November, just to...
Okay, so you're hoping then by the end of November, I mean, what does it look like for you after that?
I guess I'll be going for checks because it's triple negative. They'll be just making sure that it doesn't like start up again. So, like I think there are risks because you're going under chemotherapy and radiation in one breast. There's the risk that it'll go to another breast, or that, you know, like I was lucky that my cancer came up as a lump, and in some people it doesn't. So I guess they'll just be a little bit more like vigilant in checking, like ultrasound, that there's no kind of foreign cells there, and make sure it doesn't get into lymph nodes again or anything like that. So.
And I think I read somewhere, did you undergo IVF at some point?
Yeah, so that was
So will you tell me about that? You know, I suppose why and how did that go for you?
It was okay. Like I was kind of asked at my first oncology meeting, do you want to freeze your eggs because chemotherapy can, obviously affect any fast growing cells. So yeah, when you're entering your 30s, like, okay, mortgage, do I want kids? Do I want to do all that? And this is all
it's
like,
a lot of big
do I want
decisions,
kids?
isn't it?
Yeah. It's like cancer, kids.
Yeah.
So,
all of a sudden, I've
yeah.
just finished my PhD and here's cancer in kids coming in.
Literally, it's just like, do you want kids? I'm like,
Yeah.
So yeah, that was a bit mad. So yeah, I had to do a few rounds of like injecting yourself with estrogen and everything. And I actually spent my birthday up there getting
Your 30th.
Yeah, my 30th up in an IVF clinic. So it's definitely a unique story amongst my friends. So I'm like, who else has done this? So
yeah.
But yeah, it was okay. Like the procedure went grand, and I have any future ice babies in liquid nitrogen or somewhere up in Dublin. So
it's a lovely picture.
I know, little ice baby. Yeah, Mum is telling me to call them Elsa and all these from Frozen. Like I'm never doing that, but. Yeah, so it kind of helped a little bit because, I had the surgery and then suddenly I was up in Dublin doing these IVF things. And that finished at the end of May. And then I had a few weeks before chemo. So
is there a relief to knowing that you've done that and that, if you do decide to have children in the future, your options are there?
Yeah, absolutely. Because like even during my chemo, I get this injection called Zoladex. So it kind of puts your ovaries to sleep so that they're not completely, unusable. But it's kind of nice. Like, when I decide to have kids, I'm like, okay, if I can't naturally, then my ice babies are there. Right. And yeah.
Okay.
But yeah, it's definitely something that it's kind of off I just want to get over this first, and then I guess future Aoife can deal with that. But it is very comforting to know that they're there. And
as you say, like not exactly the ideal way to spend your 30th.
No, not really. But it's
so you weren't off in Ibiza; you were in the IVF clinic.
In an IVF clinic, yeah.
And tell me, academically, then where are you? I mean, you've obviously you obviously took a break. You'd already sat your PhD 5, but you obviously took a break once you got the cancer diagnosis. So where are you now in terms of that, and where what does the future look like for you academically?
So like when I finished my PhD, I was applying for different jobs and everything, and I got a postdoc position over in Norway, but I got it the same week I got my diagnosis. So everything
you were offered a postdoctorate position in Norway.
Yeah,
the same week you got your diagnosis.
Yeah. I know you can't make this up.
I know
it's just like no one's going to believe me on this. Like, So I had to, obviously put that down.
Would you have liked that?
I think so. I think I would have. Yeah, it was very interesting.
It was hard to know when you didn't do it. But
I know. Yeah, it was just like, oh yeah, at the time, but I guess now I'm kind of not thinking academically at the moment, just trying to get my head back in. Like I'm still reading research papers, and to be honest, I was being such a nerd, like looking up about the different drugs that I'm on. Like I really like understanding what is happening. And I know some people just like to completely forget about it and, let the doctors do it.
But you weren't Googling it. You were doing, you were looking at research papers.
Yeah. Just have to, it's like, okay, so this has changed since I did my master's. But yeah, like the plan, to be honest, was to always go back into breast cancer research. And it's something I definitely want to do. And I'm hoping to start back into maybe in October or so. And
where?
At the Lamb Institute in
Fantastic.
University of Galway. Yeah. So
it really has come back around. I mean, that's a full circle, isn't it?
Yeah. Like, since my master, I always had this interest in breast cancer. Like it's so close to the lymph nodes, and there's so many different types as well. Like, breast cancer, there's, it's from estrogen, like luminal A or HER2, like there's different types. And
to be honest, Aoife, I mean, just even from doing these podcasts, I had no idea that there were so many,
different subsets. And
yeah, absolutely.
Yeah.
Like really no idea. So I mean, I think a lot of people don't. I mean, I was saying it earlier. I mean, I think a lot of people just think of it, in a very generic fashion as just being breast cancer.
Yeah.
And without realizing that it's very specific and targeted, and all the variations and the presentations.
Yeah, like I mean, triple negative is different to the luminal B, which is different to HER2. Like it's so complex, and one treatment option isn't going to necessarily benefit another.
Which is again, I suppose, why with all the research that's being done by the National Breast Cancer Research Institute, that there's much more targeted treatments now, and that it's certainly not a case of one size fits all.
Oh, absolutely. Like I think even in the last couple of years, like even since my master's, there's been so much research, and a lot of that is coming from like kind of public communication and fundraising, like the Mother's Day breast cancer walk, like that garners so much money for breast cancer research and funds PhD students and postdocs, and the ability for labs to look into other different kind of treatment options. And yeah, like it's great that it's getting so much awareness now, because I guess like even when I was in college, there wasn't very much awareness. Like everything was kind of about like HPV and cervical smears, and making sure like everyone knew how to look after themselves in terms of that. But there was very little on breast cancer and how to look after yourself in that sense.
Yeah,
that makes sense.
And do you feel when you go into the Lamb Institute in October, or whenever you go back in, and you're working in breast cancer research? I mean, obviously, you didn't choose to do it from the practical end to actually have breast cancer to go through that, but I suppose it does add a different dimension to your research.
Yeah, definitely. Like I'm able to kind of cut myself off between like researcher and patient. Like it's definitely quite handy to be able to think of it in both terms and be like, okay, how would I feel like about that? But yeah, I mean, the plan was always to go back into breast cancer research, and just the little blip isn't going to really stop the research side.
Did it change your do you feel it changed you as a person or your attitude to life, particularly again because you are so young?
Yeah, like I think initially it was very claustrophobic because you don't hear as much about young people getting breast cancer or anything like that. So I did feel quite. It was kind of difficult because, it was stage 1, so it wasn't like metastasized or anything. And I was younger. So I kind of felt weird to think about it realistically and think like, okay, I'm dealing with this. And there were some people I was telling and some people I wasn't telling. And just to kind of give yourself a break, it was like, these people don't know. I can go about my life and they don't know that it's a wig and everything like that. But yeah, I definitely have a different aspect in that, I don't really think about the little things anymore that can kind of bug you. And it's like, I really don't care. I'm going to go off and do this now. And yeah, just kind of definitely going to take a lot more holidays than I was during my PhD and just enjoy it a little bit more. But yeah, I think.
And actually, since you did mention weight there, so, did that affect you again? Because I mean, look, it doesn't matter what age you are. If you lose your hair, you lose your hair. But how did you react to that? At what stage did it happen, and how did you react to that?
Well, I shaved my head, so
okay.
Yeah, I knew. And
did you do that yourself, or did you get someone to do it for you?
I got my family to do it. Yeah. So I think initially we decided we were going to dye my hair so that I could kind of disconnect from it, and we had this great plan of like electric blue, and it didn't stick. It just washed straight out. So we went with bright red, and that managed to stick. So that was great. And that lasted for a week and a half before I shaved it. But yeah, I went home, and like my parents and my brother and his girlfriend and my boyfriend, we all just kind of went at it and just shaved. It took us an hour. We kept looking up YouTube videos on how to shave heads. It was just yeah.
But that must have made them feel again, more a part of it, and that you're all moving forward together. And this is this is just another step on the way.
Yeah, I think it definitely helped process it a little bit more. Yeah. That you're like, okay, it's not Aoife walking in suddenly with no hair. Like everyone kind of saw it, and there was videos and everything. Like, but yeah, I was expecting it to. Like, I'd looked up a few forums and everything, and they were like, oh yeah, it can. Maybe the second or the third cycle of doxy, it's going to fall out. And it did. It just started shedding after a while. I'm like, okay, and just got a trimmers and shaved the rest off. Like, but the eyebrows and eyelashes have stayed, thankfully. So,
and you have a great set of eyebrows, actually.
Thank you. Yeah, they used to be bigger. They're kind of thinning a little bit, but
Well,
they're
they're still
sticking.
very good.
Thank you.
Yeah, they're still very good. So I suppose what kind of guidance or advice or tips would you give to other women who are listening to this?
I guess you kind of like you're going to feel quite claustrophobic about it, and everything is very muddled, and people are always going to have different things that will help them and not necessarily you. So you kind of just like if you can make a joke about it and you can have that kind of humor, and you're almost
And you clearly did.
Yeah, heal with humor and everything.
Yeah.
But yeah, like try and find your own way of not letting it control you, because it's something that like the end goal for cancer is to destroy you, like, so you can't really let it. And you're doing everything you like, you're doing everything you can, like if you're doing chemo or surgery or radiation, like you're stopping it. And yeah, if you're the heal with humor type, just make as many jokes as possible about it. But kind of give yourself a break as well. Like if you're tired, go to sleep.
So be kind to yourself.
Yeah. Like,
is there anything that you wish you had known, that you now know that you wish you had known when you were going through it? Is there anything at any stage did you say, God, I wish somebody had told me that this would happen, or that I should have done this, or whatever?
Well, I think initially the kind of shock factor when you're going for chemo itself, and you're seeing a lot of different types of patients going through a lot of different kind of procedures and different drugs and everything, and it can be a bit scary,
daunting.
Very daunting, because especially on your first, and you might be seeing somebody who's on their 5th or 6th cycle or something, and it's a bit of a shock, and they're all going through their own journeys and everything, so it's definitely important not to compare yourself to other patients, because they're going through different treatments, they're going through different cancers, and just kind of focus on your own thing. It's just like, okay, this is how I'm feeling now.
That's really good, actually. I think the not doing the comparison, because again, your cancer is very specific to yourself, and your treatment is very specific and targeted at you. So rather than kind of looking at everybody else, just concentrate on yourself. Yeah,
I mean, like your doctors know everything about you. They're giving you the best treatment that's suitable for you, and just to really trust them, to be honest. And definitely don't compare yourself to other people. Like if you're having worse days, that's completely fine. Like when I was kind of looking up, I was reading about patients that were able to go to the gym, able to go out, and I was in bed for a week. But it just depends on your treatment. Like they could have different stages, different drugs, different, timelines.
So you can't force yourself to do what other people are doing just because they can do it.
Yeah, like you're going to be on a completely different dose as well. And, your body is going to react differently. Like some people get sick, some people don't. Some people, lose their eyebrows, some people don't. Like there's so many differences that will occur.
I do think the key, to your story is that, the importance, first of all, of highlighting the fact that breast cancer can happen to anyone at any stage in life. So I suppose that's the importance of knowing the symptoms and knowing how to check yourself and to look for signs, because not everyone's going to catch it at stage 1 anyway. But to at least, I suppose, if the awareness is there, is that right?
Yeah, like I was just lucky that mine was a lump. Like sometimes it's not, and sometimes
yours was painful as well. You said, wasn't it? Yeah.
So when I first looked that up, it said like, oh yeah, this can usually be fibroadenoma. So if you do find something strange, just don't go to Google and just go to the doctor, because if I'd listened to like Google and fibroadenoma, it'd be a different story now. Never mind back in May, Yeah,
so don't rely on Dr. Google and just go to, your own GP.
Yeah, like just trust your instincts really. And, if it's sore and...
But as you even said, and even with all your knowledge, you hadn't realised there might be pain there. So I suppose, again, it's, knowing that it doesn't have to be a lump. It doesn't have to be painful. It doesn't have to not be painful.
Yeah.
But if there's something that's different, you need to get it checked.
Yeah, absolutely. Like something that doesn't feel right, and you're just like, that wasn't there before, or it's catching on sore, you can't lie down or anything like that, just get it checked. Like you do read up sometimes that people can be embarrassed, and that there's that kind of I don't want to have to take off my bra with the doctor or anything, and just like it's like 10 minutes of embarrassment, and then if that's the worst thing you leave with is embarrassment, then
and if you're wrong, it's great. But, you need to find that out.
Yeah, it's completely grand. You can just leave, yeah, bit red faced and you'll be fine. It's just like, no, it was a cyst. It's nothing. It's
Yeah.
skin. Yeah, like that's the best news that you can leave with.
Absolutely. So
yeah.
it's one time that it's good to be wrong.
Yeah, pretty much.
Yeah. And I suppose again, the message to get out there is that, you were checking yourself from your kind of your mid-20s, you said, wasn't it?
Yeah.
So, again, for young girls and young women to be checking themselves constantly.
Yeah.
And to know your body, I suppose.
Oh, definitely. Like, I mean, you don't have to be like meticulous and just like, oh, every single month at this particular day or anything,
Yeah.
but just have an idea of your own anatomy and figure it out. And, like I think especially like before I was reading about it, sometimes there's the whole that is linked to BRCA and that, it's hereditary and you don't have it in your family or anything. And you're just like, I mean, I think it's less than 10% is actually hereditary.
Yeah.
It's, it can be life, it could be, environment, it could just be absolute random universe,
Yeah.
like there doesn't really have to be a reason.
Yeah.
Like
There doesn't have to be any reasoning.
Yeah.
Yeah.
It
So it's
just
anybody,
happened.
any life stage, any age, and you don't have to have any sort of family history. It can just happen.
Yeah, it's just a random little blip sometimes, and
Yeah.
you just have to deal with it, really.
Look, Aoife, I think you'll be a huge addition to the Lamb Institute and to breast cancer research, and they're very lucky, to have somebody like you, from both coming at it from both sides of it now. But so look, the best of luck, and I hope that into the future, your work and your research will help more women.
Yeah, fingers crossed. Yeah.
Thanks, Aoife.
Great, thanks, Aileen.